Well, hello again. Today I'm going to talk a little bit about counselling. I've been a counsellor myself, done lots of psych studies over the years, rehabilitation counselling, been a counsellor, worked for Victoria Police here in Australia, work with people who've had physical injuries and then helping them with their psychological component of that, and then also working with people with PTSD and trying to work through all that stuff. And while I do believe that, counselling certainly has a place, it's really important that people understand that we need to look at different other methodologies as well, including, preventative stuff, obviously. We can't stop things from happening to people, but we can certainly help with kind of better group work at school level. People that have influence, I think, can do a hell of a lot more. I don't think schools do enough. I've tried in the past to look at coming in and helping in an education space, and the schools don't want to borrow it, and that's fine. I understand, people have their own views of what needs to happen, but essentially I do believe that we don't do enough preventative work, and we don't necessarily focus on, studies even in schools, because the schools kind of don't allow things to happen. Their view is that they want to, have, programs that can prove that it's already successful, but they won't allow you to actually access the school to do those things and run those things, and so you never get the data, and nothing really seems to improve in that space. But anyway, not trying to bag anyone about that, but essentially for me, yes, there's a counselling piece what we do with the person one-on-one, generally speaking. There's obviously some programs where you have group sessions, but ultimately I don't think that counselling does enough to really focus on how that whole group activity stuff works, and understanding that what happened to an individual affects their ability to form relationships with other people and all that stuff. So there's some really good, obviously, research out there. For those of you that heard ACEs, which is Adverse Childhood Experiences, they done research, I think it was in the 90s, 95 to 97, 17,000 people, all that sort of stuff. So a lot of data there. And what they pretty much found was that, there's kind of 10 adverse childhood experiences that contribute significantly or increase the risk of, a lot of other health issues. And I'll say health issues just globally. 8 out of 10 of the biggest killers in the US, these ACEs actually increase the chances of having 8 out of those 10 things. So for those that don't know what ACEs are, it's stuff like, child physical abuse, child sexual abuse, child emotional abuse, emotional neglect, where you're just withdrawing your love and not giving them any care, all that sort of stuff. Physical neglect, so not feeding your kids, not clothing your kids properly, all that stuff. And then, having a mentally ill person in the house, or depressed person, or a suicidal person, these all increase the chances and other adverse childhood experiences. Stuff like having a drug affected parent or an alcoholic parent, that increases it as well. And then there's, other stuff like witnessing domestic violence. If you see that, obviously that's not a great experience. And essentially, it affects the child.